Good afternoon, everyone. Happy Friday. Thank you so much for joining us today for Medicaid Post-Pandemic, Helping Clients Preserve Healthcare Coverage as COVID-19 Protections End. For those who don't know me, my name is Alexis Alvarez. I'm Director of Statewide Training at Florida Legal Services. And I'm very excited to collaborate with two amazing women on this awesome webinar series about something that is so important and so poignant and relevant to what's going on currently with Medicaid protections post-pandemic. So before I go into introductions, I want to give some housekeeping announcements. This is being recorded. A copy of the recording will be sent to everyone who's here and anyone who registered within 24 hours of the event. Also, this was approved for CLE credit. I will announce that CLE code towards the end, and I will also put that CLE code into the chat, and that CLE code will be included in that email, the follow-up email with the recording that I just mentioned. Final piece of housekeeping announcement, questions and answers. We always love to hear from you. We love to be interactive, especially we know that this is a subject that is a little clear as mud, as some might say. So please don't be shy. Please put your questions into the chat or the Q&A. I'll be monitoring those and I will present them to our speakers in live time. So if something comes up on a slide and you have a question about that, don't wait till the end, pop it in there and we will get your questions answered. So enough of the boring stuff. It's a Friday, we have great content, great speakers. I'm going to move right into introductions. Today with us, we have Amy Lean. Amy currently directs Florida Legal Services Connecting Kids to Coverage project. Previously, Amy served as a staff attorney for the Florida House of Representatives Healthcare Services Committee, legislative counsel for a statewide legal association, director of public policy for a statewide disability rights organization, and led the Children's Legal Services work at Florida Legal Services as director of policy and advocacy and director of disaster response. Amy has served as member of several state agency advisory boards, including the Agency for Healthcare Administration's Medical Care Advisory Committee, the Florida Kid Care Coordinating Council, and the Department of Children and Families Independent Living Advisory Council. We also have with us Christina Russo-Walters. Christina is Manager of Public Interest and Medical Legal Partnerships at Community Legal Services, where she oversees the sustainable implementation of medical legal partnerships. She is recognized as a subject matter expert and has presented on medical legal partnerships and their benefits to patients, healthcare providers, and healthcare systems' bottom lines at the state and national level. Christina has dedicated her career to serving Florida's most vulnerable communities, working as a staff attorney with Legal Aid Society of Palm Beach County prior to joining Community Legal Services in 2017. She currently sits on the board for Volusia Flagler County Coalition for the Homeless. And with that being said, I'm going to turn it over to our speakers. Thank you so much for being here. Thank you for teaching us on this important and seemingly ever-changing subjects. And thank you for all that you both do for our legal aid community. And the floor is yours.
Thanks, Alexis. I'm going to go ahead and share my screen with you all. Thanks for having us here. And I have to say, I am honored to be speaking with Amy because she is somebody I have looked up to through my career, and I am so excited to be here speaking with her. So today we're going to talk to you about Medicaid. We're going to give you a little bit of background about coverage in Florida and talk to you about how advocates can help clients navigate the end of the public health emergency and the return to Medicaid renewal practices. We're going to talk about how clients can access other healthcare options for those who are no longer eligible for Medicaid, how we can help populations and communities most at risk of losing coverage, and additional resources that are available to them. And as Alexis said, if at any point you have questions, please feel free to throw them in the chat so that she can stop me. And if I'm speaking too fast or not clear or something, please stop me also, because I'm definitely a fast talker. So getting into what Medicaid. So Medicaid is critical for Floridians. About a quarter of Floridians population of Florida's population is covered by Medicaid. And since the beginning of the pandemic, the enrollment has grown over 30% in Florida. We had about 3.6 million Floridians covered in February 2020. And as of January 23, we had 5.6 million. There's about 2.6 million Florida's adults that are covered, and 65.7% of Florida's children are covered by Medicaid or Kid Care and CHIP. So as you can see, it's very important for Floridians, Medicaid, and the coverage is widely used by our populations. So these protections were put in place at the beginning of COVID. In March 2020, the Families First Coronavirus Response Act was signed, and among other things, it gave states additional funding for Medicaid if they did not disenroll folks during the emergency declaration. We had a public health emergency first declared in January of 2020 due to COVID, and that was extended every 90 days throughout the pandemic. We expect that this is going to end on May 11th, 2023. So if I said that it was tied to the public health emergency, why are we talking about this unwinding now? Well, in December, Congress passed a new law, and this one unlinked the public health emergency from the end of the Medicaid continuous coverage requirement. And so now this means that we have the public health emergency still in effect. We expect, like I said, for that to end May 11th, but the continuous coverage requirement ends today, March 31st, 2023. And as part of that, states had to release Medicaid redetermination plans. Florida's plan has a lot of information in it, and it's available online. We're going to go ahead and give you a list of resources that has it, and the PowerPoint as well. And this is a link here at the top to that redetermination plan. And so DCF is the organization in the state of Florida that does Medicaid eligibility. And they will go through Medicaid eligibility for all Medicaid recipients starting March of 2023. They'll have 12 months to do this, so they will have to complete this process by April of 2024. They're going to do what they call ex parte review. So they're going to use the information that they have, and if they can determine eligibility based on that, they will. If not, they're going to go ahead and send recipients a notice 45 days prior to the renewal date, telling them what they need to do. New applications are going to be processed under the old standard rules. And DCF is going to be using technology to do data matching. So they're using wage information that they have from the state. They're using other information that might be provided through other applications, like applications for food stamps or TANF. They're also going to be spreading out renewals across the year. So not everybody's going to have to renew right now. They're also aligning renewals for family members amongst all the family members in a household and all of the benefits that a family receives. Right now, you might have one family where there's multiple people receiving different benefits, and they'll have different renewal dates. DCF is trying with this process to get all of those renewal dates for the household to be one, so that the family only has to deal with one application, one renewal, instead of multiple times throughout the year. In theory, this should help folks. During the pandemic, DCF has not been terminating people from Medicaid coverage. However, they have been processing redeterminations. So they've been doing reviews internally using that ex parte review process and using the information that they have within their system and the other data that they have access to, and have actually been flagging cases that are not eligible, and also cases where folks have not responded to information. So between those two groups, as of December 2022, we had almost 2 million cases that were flagged. DCF is using this to help with the priorities as to who will get the renewal process started first, the redetermination process. So they're looking at those who have been previously identified as ineligible through those prior redeterminations, and also those who have not used their benefits in the last 12 months. Those are supposed to be the folks who receive redetermination notices first. In theory, they either, the folks who have not used their benefits in the 12 months, the idea is that they either don't know they have those benefits or they have other coverage now and no longer need those benefits. They're also using priority group folks who are SSI recipients, but who have been determined ineligible by SSA. So Social Security has said you're no longer disabled or you're not disabled. And so those are the folks in another priority group. Luckily, DCF is delaying review for some vulnerable groups, and they've named 2 for us so far. Those are recipients under 21 diagnosed with a medically complex condition and SSI-related institutional care and hospice care individuals. This is just a timeline for you of what's happening with redetermination through this first period. So DCF started the process in March. So the beginning of March 1st through 3rd, they started the ex parte review process, doing all the data matching. For those that they could not determine were eligible, on March 15th, they set out the first set of notices, letting folks know that their benefits would be terminating and that they needed to do the redetermination process. Today is the day that the continuous coverage requirement ends, and tomorrow Medicaid renewals and applications start being processed under the regular standard. Those who are not going to be eligible for Medicaid benefits will have another notice sent out to them 10 days before benefits are set to end. So for those whose benefits are set to end April 30th, a notice will go out on April 19th, letting them know that they have 10 days. And that's that 10-day adverse action notice. So now I want to talk about some of the eligibility requirements. My slide always gets stuck here. Oh, I went too far. Okay, so Medicaid eligibility groups. We have 2 major categories: family-related Medicaid and SSI-related Medicaid. The groups that we are talking about here are the ones are going to be mostly impacted, are going to be the ones in those family-related Medicaid categories. So we're looking at parents and caretaker relatives, pregnant women, children up to age 18, children aged 19 to 21, and former foster youth up to age 26. Each of those are different eligibility categories. We also have SSI-related Medicaid groups. So those who are aged 65 or older, those who are blind, and those who are disabled. There's additional technical requirements such as social security number, immigration status, child support cooperation, and that information can be found within DCF's policy manual. So the reason that I mentioned the different eligibility groups and the different age categories is to point out the different income limits. So depending on which age group and which eligibility category you fit into, there's a different income limit. And this is going to make a big difference for families because, as you can see, parents and relative caregivers only have an income limit that's about 26% of the federal poverty guidelines, whereas children and infants are 133% and 200% respectively. This chart shows you what DCF's limits are for Medicaid, and I'm going to explain to you a little bit how to use this chart so that you can help folks understand whether or not they would be eligible for benefits moving forwards based on their income. So first you have to determine the eligibility group. That's those different categories, and you can see those here across the top of the chart. Then we look at the income limits, and we add the income limit plus the standard disregard, so the left column plus the right column. And then all the way to the far right-hand side is that light green column, and that's the MAGI disregard. That gets added to all groups except children aged 16 to 18. So in real life, this is what it looks like. We have a 6-month-old, and we add the base amount plus the standard disregard and the MAGI disregard to get an income limit of $5,275. With our 4-year-old, though, they would have a standard, the base amount is only $3,324. So you add that plus the standard disregard plus the MAGI disregard, and we have a maximum income amount of $3,624. Now that's a big difference for folks, for families when they look at coverage. It gets to be an even bigger difference when we start throwing in teenagers. So looking at a 16-year-old, $3,325 is the standard disregard, is the base amount. 125 is the standard disregard, but there is no MAGI disregard. And I don't know why my numbers got out of order here, so I'm just going to click through. Mom in a family of 4 would have the base amount of $364 plus 221 as the standard disregard and the Magi disregard 125. So mom's maximum income is only $710. And you can see why in Florida we have many adults who do not have coverage because when they do fit into a coverage category as a parent or relative caregiver, the maximum income is very low. So with that said, what we want you to keep an eye out for while you're helping folks who have Medicaid is DCF's failure to place folks into a new coverage group. As part of the ex parte review, they should be determining whether or not folks fit into other Medicaid categories, including those for disabled and the medically needy program. Also keep an eye out for due process issues like failure to inform for the reason of the termination and attempts at informal resolution, which can help dissuade folks from using their appeal rights. Amy, I'm going to go ahead and pass it over to you to talk to us about who might be most likely to lose Medicaid coverage.
Okay, and thanks. And first off, I'll start off apologizing if I may have had something to do with getting your numbers messed up, Christina. So thanks. And I just have to say before I go on, I am just so excited to be presenting with Christina as well. We, as she mentioned, we go way back, and it's just always such a pleasure to work with her. She has just such expertise on these issues and just really works with everyone all around healthcare. So she's just a fount of knowledge. So, but as she said, we're first looking at what to watch for, but then I think it's really important to kind of know who to watch for, who is most likely to be losing Medicaid. And as you could see when Christina went through the income lines, adults who with more income, because adults we can see have a very, very low income threshold, that in order to be covered, if they've made more income, then they're going to lose Medicaid. And as well as parents who no longer have minor children or who are caretakers because their younger children are adults now, and so they're not getting coverage as parents. And again, women who received Medicaid when pregnant. However, there is exciting news on that. There is, Florida now has followed the postpartum coverage, and hopefully that will become permanent in 2024, and we're kind of waiting on that for sure. But right now, women should be getting postpartum coverage as well. However, at the end of that, there is another category for family planning, as Christina mentioned, that we want to make sure after that's over that women are getting in that as well. And then children who moved to a new age group. And that kind of leads us into, and Christina's doing the fancy work, there we go, families who get caught in the administrative churn, because those children who move to a new age group they should not be losing coverage. And we're going to talk a lot more about the transition from Medicaid to CHIP, which we all call kid care. But children might be losing Medicaid, but they shouldn't be losing coverage under kid care, because most of them, I mean, and the great majority of them, if by chance they lose Medicaid, they should be covered under CHIP. But in addition to that, there's this concept of families who get caught in administrative churn. And by that, we mean procedural issues, problems, failures. Failures to respond is kind of, I think, what the state wants to say a lot, but it's that kind of puts the onus, or puts everything on the applicant who didn't respond. And sometimes it's not a failure to respond. Sometimes it's an inability to respond, or it's that they've tried to respond and the system's not working. Or, we work with clients all the time who come to tell us that they've just been locked out of their account and can't get in. So I kind of hesitate to say failure to respond in this renewal, because I know there are a lot of families who are trying to respond, and it just becomes a full-time job to try to get into the system. So there's that kind of inability to respond. Maybe they weren't able to provide the information, and it's because letters got lost, or the mail. accounts weren't updated. And there also can be just simple administrative mistakes that are sometimes made. And as Christina mentioned today, there's been a lot of planning through with the departments and all the agencies involved with Medicaid. They've had to do a lot of work with figuring out how they were going to do the redetermination plans. But there was also a lot of administrative work, or a lot of things that they had to do to keep everybody enrolled in Medicaid throughout the process. And I think Christina and I were at a meeting, maybe some people on this presentation or on this webinar were at similar meetings where the state has kind of described how they've had to sort of trick the system, or find ways to maybe change dates temporarily, dates of birth, to keep someone eligible for Medicaid in their system, and then go back by hand and make sure that the dates were changed. And that was all just to keep people covered, which is absolutely what everybody wanted. But to work with a system like that, and to kind of have to do these unprecedented things that weren't done and weren't ever expected to have to be done to keep people enrolled, it is a lot on a system. So there's the administrative churn this time as well, I think, can also include maybe some system breakdowns, just absolute mistakes that are showing people ineligible when they're not. So that's fingers crossed it won't be, but when we're ever doing something this huge, it's definitely mistakes and errors can be made, not just because of failure of recipients to respond, but also at the agency levels where people are actually doing the determinations. So I think we can go to the next slide.
Quick question before we move on. Someone did ask, these individuals are most likely to lose Medicaid, but how do you find them? So I think that might be an outreach question, or maybe a way to more effectively identify who might lose Medicaid. I know you sort of already talked about that, but I don't know if there's an outreach component to it that this question is asking.
And I mean, maybe we could get a little bit more, how does the system find them, or how does their eligibility process find them, or how do we find them as advocates or attorneys?
I took it as advocates or attorneys, but if the attendee wants to clarify, please feel free to clarify in the question, the Q&A or the chat, and I'll bring it back up.
Okay. And absolutely, and I won't get too far ahead of us, and I know Christina probably has more to add on that too, but there are several projects, and one of them I want to talk a little bit more towards the end about a new project that we have, our Connecting Kids to Coverage project, where we really are doing some intense coverage in areas that we have targeted, that we've found that people have had more barriers to accessing Medicaid, or problems with technology. And so our children coverage for children's project is definitely going out and doing outreach, but as more of a system issue with the department should be looking at all the information that they have available to them electronically in the files, so that they can make these determinations and see who's eligible for what at that time when they're doing the eligibility choose. So they should kind of be able to find them in their systems based on the information they have. And if the information's not there, then they need to be following up with the recipients to let them know that information can be provided. So so I think Christina's moved on to the next slide. So that's kind of what we're ending with. The point from the last one is that who to watch for is who's the most likely to lose coverage. But then the next question is, and particularly because of that churn, and we can see that maybe people might be eligible and are losing coverage. So what we really want to look at is the loss due to actual ineligibility, or is it an inappropriate loss, or is it something for a procedural reason? So we kind of want to go through those categories, and that's how we're going to maybe move forward to kind of describe what people should be doing in each of these situations. And I mean, the very first one is, the very first bullet is people who actually are no longer eligible for the category they are in, or their Medicaid coverage that they were in. So they as we said, a lot of adults most likely will lose Medicaid coverage simply because they're no longer eligible. They're back to work after COVID. Their income has increased, so they will need to look for other options. But then there are going to be some who may lose coverage due to kind of all the errors and the churn that we discussed. And even there, though, it's important. Some of them may be errors that clearly need to be appealed, that there's no choice. The state's been involved in that, just been a clear decision that will need to be appealed. But then there are other people who may lose their eligibility, and this might be more of the recipients who weren't aware of the re-enrollment or who did not provide the information that they needed to, or there's still other information that they needed to provide. So we'll call those the failure to update accounts. And that's very important to kind of know that those denials or those people who receive the information that they've been denied or that they've lost coverage, they shouldn't be appealing. We want to make sure that they, if they're still eligible, can immediately update their accounts as soon as possible. And for that reason is because there is some federal rules or federal regulations that require the state to keep the account open for 90 days and to accept information or updated information that the person who lost coverage failed to provide during the re-enrollment. And that way they don't have to do a new application. And this is kind of interesting, and Christina and I both have been looking everywhere, and I'm curious if others have seen how much Florida or DCF is promoting this in their materials. They have toolkits, and as Christina mentioned, the big plan that they have, and lots of information on their website. But this seems to be something that I think I've just heard them gloss over much, and it is a federal rule, and it should be something that is promoted, I think, a little bit more, because if families are thinking that they're going to have to go through the reapplication process all over again when all they might simply have to do is submit updated income, there's a big difference then, and one thing can take a lot longer, and we don't want people having to go through a whole application process when everything is happening in the next year. So we want to keep re-enrollment as simple as possible. So that's the big thing. I just wanted to point that out. We've got it. If it actually is loss of coverage, and there seems to be clearly a mistake, and it should be appealed to do that. But if there's any way, if it's just failure or something in the account that needed to be updated that wasn't done, definitely take the 90-day update road. And then that kind of leads into our next slide, but I did just want to point this one more time, and you're going to hear us say this so much, is that in that who's losing coverage, children should not be losing coverage. However, they are most likely, and even in the past, in times when we weren't going through COVID, and just during the re-enrollment process, children, and because in Florida they are covered, there are more children covered in Florida than adults, they are likely to lose coverage more in the turn. And those would be children who are eligible, but they've been cut off because of administrative reasons. So, all right, so now we're ready to go on to the next one. So, and this was we kind of covered this before, but as we said, if it's an absolute mistake and it's wrong, and Christina's kind of laid out when and when not to file the appeals, but you definitely want to request a hearing. If DCFs failed to place a new the client in a new coverage group that they should have been fit in, but you do want to do it if they've miscalculated income or household sizes, mistakes like that. But again, if your income's too high and you're just no longer eligible anymore, that's definitely not the time to appeal, and that's the time to look for your other options. And I think that's leading us into our next slide that I'll hand over to Christina. But I did see some questions, but I haven't read them. Alexis, are there
No,
anything we want to cover
no
now?
questions. No, just a little bit of
Okay.
questions about the materials and things to be shared, things like that.
Okay. All
And
right.
just one more note on appeals is that folks have 90 days to file that appeal. And if they have 10 days, if they file the appeal within 10 days, they can request that their benefits remain ongoing and pending while that appeal is in process. So that 10-day deadline is super important for folks not to have a gap in coverage. But if they're, sorry, Amy, go ahead.
No, go, you go.
Okay, I was saying, but if they're no longer eligible, there are other options. There's the medically needy program, which I think we're going to see a lot of adults get put into the medically needy program who have Medicaid currently. And for those who don't know, the way that the medically needy program works, it's very similar to having an insurance deductible, but it's monthly. So at the beginning of the month, you have to meet your deductible. Once you've met your deductible, Medicaid kicks in for the rest of that month. During the COVID pandemic, once people have met the medically needy, what we call the share of cost, once they've met that 1 month, they have kept their coverage throughout the pandemic. And so now moving forwards, they're going to have to meet that every single month. We're going to see those folks lose coverage, but that is a program that might be available to folks. Medicare is another program available to those who are 65 and over, and some folks who are younger and disabled. We also have federally subsidized health programs through the ACA marketplace, for, I guess, folks know it as Obamacare. Commercial coverage, you see that's your employer coverage. Federally qualified health centers are clinics that run on a sliding fee scale and also accept Medicaid and Medicare. And so some folks will currently who have Medicaid might be receiving their care already at an FQHC and can stay there receiving coverage, health services, but now on a sliding fee scale based on their income. We also have free and charitable clinics, which, like the FQHCs, are free or no cost services, though they do not accept Medicaid. And then we have CHIP coverage for children through Florida Kid Care Program. Alexis, did we have more questions?
Yes, 2 questions came in just a minute ago. One of them is appealing within 10 days enough to have benefits continued pending a hearing, or does there need to be a separate request?
You have to ask for the benefits to remain pending through the appeal. I've seen where if you don't specifically state it, the DCF will fight us on it. So always best to ask for the things that you want.
Sure. And the second question was, it came in just literally a minute ago. So how do you request aid pending?
How do you request what?
Aid pending.
So Medicaid, I'm assuming it's a similar question to the last one. When you do the fair hearing request, and Amy, you can fill in if there's anything additional, but you can state in that fair hearing request that you wish for the benefits to continue pending the appeal.
I see. Thank you.
Yep. Amy, did you have anything?
Well, that just reminded me of one more thing. And I think we'll want to share it, Christina, and we'll add it, but DCF does have the process that people should follow through Medicaid fair hearings process, and I haven't looked at it in a while, but I'm curious what their directions on that is. So we'll make sure that that goes out with our materials and kind of check and maybe flag to see, because that would be interesting to, I mean, what Christina said is absolutely right, but it's also interesting to kind of see how DCF is guiding people on that as well. So we'll make sure that those get out in the resource materials.
Just wanted to touch on a couple of things regarding some of these coverage options. And the first is regarding special enrollment periods. So typically with Medicare and the health insurance marketplace, there's only certain times of the year that you can enroll unless you fit into a special enrollment period. And so both Medicare and the marketplace have special enrollment periods specifically due to folks losing Medicaid because of this Medicaid unwinding issue. And so for Medicare, it starts for the special enrollment period starts for somebody when they receive that notice of the future termination. So that could be that March 15th notice for those who are losing coverage April 30th. And that special enrollment period goes for 6 months after termination. And during this, folks can decide whether they want their benefits to be effective the month after they apply or retroactive to when their Medicaid termination took place. If they do it retroactively, they do have to pay those premiums for those months. However, through the special enrollment period, folks will avoid the late enrollment penalties that you normally see if you do not enroll into Medicare when it is first available to you. The other special enrollment period is for marketplace coverage. And so for folks who lose coverage between today and July of next year, and the reason it's through July of next year and not April is because states have a couple of different months they could have started. And so their 12 months can be pushed into the summertime. So if they lose benefits between now and July of next year and either apply or update their application at healthcare.gov, they qualify for this special enrollment period. There's no documentation that they need to provide, just an attestation on the website, and they can actually apply 60 days before the termination, which allows them to have coverage start when their Medicaid stops so that there is no gap in coverage or less of a gap than possible if there was not that 60-day buffer. Another issue you may have heard of is the coverage gap. And this is caused because in Florida and many other states, there has not been Medicaid expansion. And so we see folks who have between 30 and 100% of the federal poverty guidelines don't qualify for Medicaid, and they also do not qualify for the subsidies available through healthcare.gov. And so they fall into this gap where healthcare either is inaccessible or inaffordable for them. This applies to our parent and relative caregivers, but also our other adults who are not disabled and not parents, so single adults or married childless adults don't qualify for Medicaid either. So they don't even have that left mountain. They're just there in the cliff. Another issue that folks may have heard about is the family glitch, and we want to let you know that this has been fixed. So under the Affordable Care Act, individuals do not qualify for the premium tax credits and the subsidies if insurance is offered to them through their employer and it's affordable. In 2013, IRS applied this to an employee's family as well. And so in real life, what we saw happen was employee had insurance offered to me through my employer that was affordable. But then if I added my spouse or my children to my coverage, it became several $100s a month. And so not affordable. Under the old IRS rules though, because coverage was available and was affordable to me as the employee, my family was not eligible to go into the marketplace. This has changed. And so now if coverage for my family members is not affordable, my family members can go to the marketplace for coverage. So this expands the people who have coverage options available to them. I'm gonna pass it over to Amy to start talking to you about kid care.
Okay, all right, thanks, Christina. So I will start by saying, because I don't ever want to sound too negative about kid care, because it probably is, to me, one of the best safety net programs, one of the best public benefits out there, in the way that it just provides children with the care they need. And it's everything that those of us who work within healthcare know that that's so important. Early treatment, early preventative care to help children grow strong and do well in school and be successful. So, but at the same time, I do have to say that kid care, as much as it's wonderful and covers all these children, and Christina mentioned, we're up to about 67% of our children are covered by kid care in Florida, and we're about, I think, the highest, top 5 in the country, about number 5 in how much our Florida or Medicaid and CHIP covers our children in our state. However, it is a very complex program. It's kind of fragmented in that it has several different agencies that have a lot of different roles that they have to play, and it all has to work together. And just right from the get-go, we've always had a problem with how we talk about it. And Kid Care actually is the umbrella program for all of the government-sponsored health insurance programs. And it includes Medicaid and what is called the Children's Health Insurance Program, which is provides coverage, low price coverage for people who just are above the Medicaid income levels over 130% or 133% of poverty, and they can pay premiums of $15 to $20 to get really excellent coverage. And that program actually in Florida, Children's Health Insurance Program, is various parts of the Kid Care program. And Medikids, as you can see on the slide, Kid Care officially includes Medicaid, Medikids, what we call Florida Healthy Kids, and which is actually a separate corporation that is one of the agencies that works with DCF and the Agency for Healthcare to administrate all of this. And then there's Children's Medical Services with children for special needs. And those children can kind of go back in between Medicaid and CHIP coverage. So we have these kind of three categories of coverage, some that it's Medicaid, some where families have to pay small premiums. And Christina, if you don't mind, maybe moving to the next slide, just so people can kind of maybe get an idea of how this all works. You can see that different ages can easily go from different categories. So you can have a family that maybe a child could be in Medicaid in the first list, but then an older sibling that might actually be officially in Florida Healthy Kids or under the CHIP program and have to pay a 15-month premium. So I say all that not, again, because I think this is a fabulous program, CHIP program and Medicaid combined to provide coverage to our children, but Florida has chosen to implement it in one of the most complicated ways they could have possibly done it in the country. And we do things like charge premiums, particularly, I think we charge some of the highest premiums for the children in the lower incomes, like the Medikids that are up to, as you can see in the first line, a family of two, 32,000 we're charging, and those, it may seem like that's a small amount for coverage, but for families at that low level, it can definitely add up. And the other issue is that in order to even be enrolled in this coverage, the premium has to be paid. And sometimes families can get behind, forget, and really one of the number one reasons that people lose their Kid coverage or their CHIP coverage under Kid Care is for failure to pay a premium from month to month. So it does have these things already in the system that have kind of made that, what we talked about before, that churn really present here in the switch between Medicaid and Healthy Kids, because at one point, and this is unfortunately stopped, but we almost used to say that there was no wrong door for kids who applied for Kid Care, and they would go through the Kid Care, which was actually the Florida Healthy Kids entity handling it, but they would go through the Kid Care application, and if first they would be determined if they were eligible for the CHIP coverage, and if they weren't, then they would switch back to Medicaid. But vice versa, if someone immediately applied through Medicaid and they weren't eligible for Medicaid, Medicaid would refer the child over to Florida Healthy Kids or the CHIP entity to do that processing. So there was always that. I can never say that it ever worked beautifully, and we were hoping for one big one entity, but that kind of has fallen apart in the last few years, particularly during COVID, because Healthy Kids has stopped taking applications at all. So we're kind of in a situation leading up, even before we go into this referral process and this renewal, all these renewals, is that there's no way someone who, even if they know they're not eligible for Medicaid and they're just eligible for Healthy Kids, can just apply there. So what's happening is Medicaid, you have to go through Medicaid, and then Medicaid eventually will refer them. So I say all that just to kind of give everybody an idea of how there's a lot of complicated parts and pieces going on, even before we start this referral process. So I see Christina switched to the next slide. So let's get into that, because that's where we are before all of this. And now as the referral process is beginning, as we mentioned, we have all these children now who are on Medicaid, and many of them will still keep their coverage on Medicaid, even if their parents aren't, because as Christina went through, the income limits, parents have a much lower level, and so a lot of parents are going to lose their coverage. They can go on to the marketplace, but their children are going to remain in Medicaid. And that's something I think, if we can really push that message, that's so important. You may have heard state officials at the legislature in particular. I've heard the Medicaid director and other people talking about concerns about this process. And a lot of the message is, oh, the people who are not eligible, we'll get off quickly. We're going to get them off quickly. But you haven't heard the state saying very much that some of those people have children, and those children are most likely still eligible for Medicaid. And so we're going to make sure they're on. And so that message, I don't think, is being sent. So definitely, as you're talking with families and they think they've lost coverage, make sure that they know that their children are likely still eligible for Medicaid. But if they're not, if the income's gone up just a little, and I won't say to go back to it, but it's there, if you can see in the charts, just up to like 133% poverty level, those children should be able to quickly move over to Kid Care or the CHIP coverage and immediately be enrolled in great coverage, CHIP coverage, as soon as their family pays the premium. So what's interesting is that how this process is going to work. And I know I'll go through it real quickly, but I do think it's important that everybody just kind of be aware that as the children are redetermined along with their families, there's going to be two different referral types that get sent to Kid Care for review. And the first is going to be the verified referral. And that is going to be the families that they know are no longer, those families went through the renewal, they provided all the documentation, and they're no longer eligible. And we know they're no longer eligible, and they know they're no longer eligible. And maybe the parents are going to the marketplace, but the children will be transferred to Kid Care, and Kid Care sees that determination, and they don't have to do anything more. All they're going to be doing is sending a letter to the family saying that they're eligible. And now you have to send us the check for $15 or $20, and then you'll be enrolled. So hopefully that should be the most streamlined, and hopefully that goes smoothly as long as the families become aware of it and then pay that first premium. The second one is, I think, going to be a little more difficult, and I think there's a lot more questions there, and we really want to be watching that. And it applies to the families who didn't go through the renewal, or were cut without providing the information, and they're going to be sent to Kid Care with all the information that's needed as an unverified referral. And so Kid Care will be reaching out to those families to have them update the information. And then once those families do provide the information, then they'll make the determination, and then they'll be able to enroll if they're eligible once they've paid. And I think the big thing that worries me there is that just kind of, if we've not been able to verify them through DCF and they've already not responded, who knows, is it because of addresses or just, the family hasn't been able to get in, something's happening. I'm concerned that Kid Care reaching out again isn't necessarily going to be the thing that lets them know they have to respond to Kid Care. So I think this is definitely something that we can do, just really spreading that word that we're making sure if we hear of families being cut, making sure that we can help them with this kind of referral process to Kid Care. I think, there we go. There we go. Let's see.
Sorry, my spinner.
Okay. That's okay. Wasn't sure if we're going back, but and I know I don't want to go too much over on this, but over on time, but so those are kind of issues and concerns to watch. I think that first thing is that we need to remember that these families, a lot of them haven't had to go through the renewal process in 3 years, and may not have ever paid premiums before. So there's just that idea that even if they get the notice that they've been that they're eligible for Kid Care, if they don't immediately follow up with that payment, the child isn't going to actually be enrolled. And just kind of that unverified referral that's going to be referred back to DCF, definitely something to watch. And Christina mentioned the medically needy referrals, and that's another area that definitely we want them. And she said, the parents might be eligible, but what we've kind of seen too is that if the parents in the accounts, parents are referred to medically needy, and the children may be as well, and it's not as clear, and that's in the access account. So it's not as clear that the child has also been referred to the Healthy Kids or Kid Care for review. So a lot of families might be thinking that that the only option is for medically needy, because they're seeing that medically needy referral in their access account, and yet they don't know that they were going to hopefully be getting a letter from Healthy Kids to say that they're eligible for Healthy Kids Kid Care. So, and then finally, one of the other things is that there could possibly be another referral back, because those parents that are unverified, if they provide the information this time to Healthy Kids or Kid Care, and it turns out they are Medicaid eligible, or they still were Medicaid eligible, then Kid Care is going to have to refer them back to DCF. So that could be like a 2 or 3 renewal process that we're waiting for. So there's definitely a lot going on. And then final thing, I definitely think it will be great if we can get a separate application again, so families can directly apply for Healthy Kids if they know they're not eligible for Medicaid, but after not having it for several years, it looks like it's going to be reinstated again this summer when a lot of other things are going on. And so I think it could be very helpful, but at the same time, to start something like that when all this is going on could also be very confusing. So I'll stop there. Oh gosh, and this, I did just want to touch on this real briefly to just save time for questions, and a lot of this, and Christina and I both tried to, we probably put a lot in the bullets, and we have things in the resources that we just kind of wanted to touch on and give you the information. And so if you are interested, you can go back and get more in the information resources that we sent. But I just really, with coverage for children in immigrant families, it's just so important. And there really has been kind of a chilling effect, and studies show that they are another group that is very likely to possibly lose coverage just because of barriers, language barriers, but also just because there's been kind of anti-immigrant legislation and attempt by some that really has provided a chilling effect. But just, it's so important to remember, they are 1 in 4 children in the US has immigrant parents. It's the fastest growing group of children in the US. And so many of them, I think we use terms and people don't really exactly understand what each of them means and put connotations on them that really aren't there. But many children from immigrant families are US citizens or qualified non-citizens. And many of you may remember in 2016, we were so excited after like 7 years to get the lawfully residing immigrant children who were 100% lawfully residing and eligible for Medicaid, who had to wait 5 years to get kid care. And that was able to be removed. So these children were immediately able to get the coverage that they needed. But quickly after that, there was kind of a chilling effect and some other negative kind of anti-immigrant legislation and rules that were pushed that kind of quashed people actually from moving forward on that. And we can just go to the next slide quickly because I know we're short on time. But and again, this is one of those issues many of you may already know, and I've kind of put the details there. If you're interested, you can get a little bit more, but it's the concept of public charge and the changes that were attempted to be made under the Trump administration. We call it the 2019 rule that really just tried to expand public charge rules, which applies to non-citizens who are applying for visa or adjustment to their status. And it is so limited. It's hardly used. It's usually basically to determine people who are getting cash assistance or long-term institutional Medicaid coverage or hospitalization, where they're basically going to be have to rely on government as their main support. So Medicaid, CHIP, all these wonderful health benefits are not considered in public charge determination, but the whole process with the public charge attempts at changes really caused a chilling effect. And fortunately, it's been struck down. The Biden administration's gone back to the way it was. And there's added protections so that immigrant families can feel hopefully better about applying for coverage that they are absolutely eligible for and that their children are eligible for. But that fear still, I think, is out there. And I've been seeing it with the families that we work with. So that's another thing. I think it's really important that we really stress to families when we're helping them apply with Medicaid or any of these eligibility determinations, that even mixed family status, a parent who may not have legal status, but their child is a US citizen or does, these applications are not for immigration enforcement purposes, that a parent never should have to say what their status is when they're applying for their child. And I've put some resources in our resource packet too, just if you're working with clients on that I think are really helpful, from Protecting Immigrant Families Coalition, that just really helps, I think, help with messaging on working with clients so that they can hopefully feel a little bit more secure when they're applying for Medicaid for their children. And that's it. All right, so that was a lot. So Christina, what do you think? Should we end with kind of a recap or what to do now?
Yeah, I think we can end. We only had, I think, 1 or 2 slides left, and I think one of them is our contact info. So let's go over what we can do now. And the big thing, the key is to tell folks, make sure their information is updated with DCF. So they can do that by going onto their Access account online, the virtual assistant that DCF has on their website. They can do it by phone, but if you've tried to call DCF really ever, you'll know that there's really long wait times usually. And so this is just going to increase that. You think we have 2 million more recipients on Medicaid now than we did 2 years ago. So the more that folks can do online, the better. We're telling folks that they can go online now and see when the redetermination date is so that they can start planning. They need to keep their eyes out for a yellow striped notice. DCF, Kid Care, all of the Florida programs are trying to use this yellow stripe across all their messaging so that it's the same for folks, regardless of which program it is. And then for those who are not eligible, they can plan now. If they're disabled, or believe they are, they can start applying for Social Security benefits. They can contact a federally certified navigator to get help with accessing and determining which insurance coverage would be best for them through the healthcare marketplace. They can find an FQHC or a free and charitable clinic. And then we also have programs like Florida's Discount Drug Card Program, FloridaRxCard.com, GoodRx, and things like that that can help folks find discounted or free medications. And then Amy, I don't know if you want to say anything else about the connecting kids to coverage.
I do. I'll just do one more plug. We are super excited about our Connecting Kids to Coverage project, and we hope it's right in time when it's needed. It is a grant that we got with the Centers for Medicare and Medicaid as a Healthy Kids grant to actually do what we've been talking about, help families enroll and re-enroll in Medicaid, families, children, and pregnant women. And really, we're trying to work with the families who do face all these barriers, who don't have 2 hours to wait to try to get to DCF on the phone, and just anything that we can do to kind of help them navigate that. So, and I know a lot of programs, a lot of people that on the call maybe do that, or maybe work on Medicaid appeals. But for those of you who come into contact with really someone just who needs to really be helped through the application process, or just really having trouble and facing some barriers, kind of that's what we're here for. So please feel free to call us. You can use that information or call me directly, and because that's our job. We've got amazing outreach specialists, all bilingual in Spanish and English, who are kind of helping us try to really target the families that we think are most likely to lose insurance. So thanks.
And that's all we've got, Alexis.
Awesome. Well, thank you so much to you both for giving us this important information, and just for all of your expertise and everything that you do in this realm. Some folks are in the chat saying thank you, saying what a great presentation this was. And for the folks in the audience, I did post the CLE code into the chat, but to say that out loud, it is 7183. Again, that's 7183. I feel like I'm leaving a voicemail. And it's 1 general CLE credit and 1 health law certification credit. Also, something that I forgot to say in the beginning is that this was also co-sponsored by the Public Interest Law section of the Florida Bar. Shout out to them. Great organization, great folks. If anybody is interested in joining, I've put that information also into the chat, and we'll include that in the follow-up email as well. Lots of thank yous coming in. I think that really is a testament to how many folks really need the clarity on this subject. So, to the both of you, thank you again. Is there anything that you'd like to say to close this out before we sign off for this Friday? It's Friday.
Just that Amy and I are working really hard to educate as many folks that might work with Medicaid recipients throughout the state. So if you work with another group and you would like to have us come do a similar presentation, we are always welcome those opportunities. We're also working together to do outreach throughout the communities, like Amy said, try to hit some of those more vulnerable populations, rural communities, non-English speakers, and partnering with them, with the clinics to make sure that folks know what their options are, and to try to get them connected to those resources as soon as possible to reduce those gaps in coverage. So please feel free to reach out to us if you have any questions or anything.
And just one final note, I know we are over, but I do just want to add, I think that we are all learning on this process too, because we've never gone through anything like this. And DCF has said they hope it's going to be this way, but just like with the COVID pandemic, we're not sure about anything. So I mean, would be so appreciative if as you all run into things that just don't quite sound right, or just as you guys are learning things that just issues, or maybe what's working right, we'd love, I think, for you to contact us on that as well, or maybe just kind of if we can just as a group and network, just make sure everybody's informed and figuring out how we can help each other on issues that might pop up that we aren't expecting yet. So we can maybe work together as a coalition to help. So please keep in touch.
Definitely. Always takes a village to do all these things. So I know your contact information is in the slides. Like I said in the chat, a copy of the presentation in PDF form will be sent to you all along with the recording and the CLE code. And, you know, to end this, I'm seeing in the chat, fantastic presentation. This was excellent. Those are great words to end on a Friday. So with that being said, thank you both so much for teaching us, and to everyone in the audience, thank you for being in community with us and for the work that you do as well. And with that being said, I think we'll sign off, and I wish everybody a happy Friday and a wonderful weekend.
Thank you.